Hey guys, this is Dr. Hub. Today we look at the adductor canal. So this is the diagram of the adductor canal. So let's look at the views. So this is going to be the anterior part. This will be the posterior aspect. Then comes the medial part and the lateral part. So let's look at the labelings. So there is some muscles, that is the vastus medialis is present. Then there is sartorius as well as the presence of the adductor longus. So what are the vessels which are seen? The vessels, there is a saphenous and the saphenous nerve as well as the nerve to the vastus medialis. Then there is a group of the profunda femoris vessels. And there is the subsartorial plexus, there is a femoral artery and the vein, and the presence of the fibrous roof. Now let's look at the boundaries in detail. So this is the image that we need to know. Now looking at the boundaries, so there is the anterolateral as we discussed above. So the anterolateral wall, it contains the vastus medialis. So anterolaterally it was the vastus medialis. Then comes the posteromedial. So PM, that is the posteromedially, there is the floor. So what does it contain? It contains the adductor longus, and adductor longus will be present above as well as the adductor magnus, and AM, adductor magnus, will be present below. Now let's look at the medial. So under medial wall, the medial wall is nothing but the roof. So here there is a fibrous band and it connects the vastus medialis with the adductor longus. So there is a fibrous band. So there is presence of a fibrous band, and what it does is it connects. So this fibrous band, it connects the vastus medialis. So it connects the vastus medialis, and the connection is with the adductor longus. The connection is with the adductor longus, and that is the subsartorial fascia. Then there are some other structures as well. So in the medial wall, the roof, we discussed the fibrous band connecting the vastus medialis and the adductor longus. Then comes the presence of the sartorius as well as the subsartorial nerve plexus. So there is subsartorial nerve plexus. Now let's look at the contents. The contents of the adductor canal, this is important. So there is, as we know, it's a femoral artery, femoral vein, then there is a saphenous nerve, then there is nerve to the vastus medialis, then there is also the descending genicular artery. There is a descending genicular artery, and there is also the deep lymph node. There is presence of the deep lymph vessels, as well as there is a two terminal divisions of the obturator nerve. So two terminal divisions. So this is of the obturator nerve. you.